All right, so we're taking it live.
It's good to
Great
see.
to have you here, Dr. Bhanusali.
Are you guys okay down in Miami?
Yeah, how are you up in New York?
It's definitely interesting over here. Everything's still closed, and the hospitals are doing okay right now. But it's a very kind of fluid situation because things can tip either way depending on how people kind of act and how quickly people spread things. So you gotta just be a little bit careful.
Right. So far so good for you, right?
Yeah, yeah. So far everybody's happy and healthy. I'm actually going to the hospitals, I think, to volunteer this week. We've been waiting a
Oh,
little bit
that's wonderful.
to get the call in, but it's I think they were so overwhelmed with applications, which is kind of a cool thing, but they're just not getting to us.
Well, we're sure thrilled to have you here with us today.
My absolute pleasure.
So welcome to the Haute Beauty, Haute Media Group 12 p.m. session. We're thrilled to have Dr. Bhanusali here with us today.
My
He's
pleasure.
a dermatologist, clinical investigator, and laser surgeon based out of Manhattan and Miami. Dr. Bhanusali is leading the next generation of cosmetic doctors utilizing novel methods and latest technologies to create results that were once thought impossible. He is quickly becoming the doctor of choice for young Hollywood celebrities as well as athletes and models around the country. Welcome, Dr. Bhanusali.
Thank you for having me.
To start out, well, everyone's, the majority of people are here at home quarantining. What's your advice for the best way to take care of yourselves, your skin, especially right now? What can we all be doing?
It's interesting. There's two different ways of thinking about it, right? So, in general, I'm a less is more kind of guy. I think that people probably use too many things, and they tend to layer, and it causes a lot of issues. So I always still like the idea of simplifying everything, but I think now it's kind of an interesting. So all my virtual patients that I'm seeing, we actually are bumping up the strengths of everything because it's kind of one of those things where if you're having some irritation or dryness, if you're still getting to a good end result, I think it's worth it. And like for retinoids or things like that, where people tend to get a little bit of peeling and a little bit of redness, I just kind of tell them, look, we can just moisturize through it. If ever a time to let your skin get used to something, this is the time, because thankfully, we do have a little bit of a break, and we can recover at our own pace. And so we're telling people just to, kind of care for your skin, but maybe have a goal now in mind. So we're kind of taking it a little bit more in a more aggressive direction.
That's great. Is there a particular line of products that you would recommend?
Depends, honestly. So I'm lucky to I serve as an advisor for some of the largest companies in the world, smaller companies, somewhere in between. I like to just, I think it's person to person, right? So
Right.
I think there's certain things that are worth the money, right? So like SkinCeuticals has a great antioxidant, but it's $160. There's much cheaper ones out there that are good as well. With moisturizers, I never recommend really expensive ones because you don't really need them. And so a lot of this tends to be more, patient specific. Spend the money on things you need to. Don't waste money on things like cleansers, moisturizers, things that sunscreen even. Like I think the cheaper sunscreens are actually great. I tell my patients buy like 5 or 6 different types, figure out which one's good for your skin, and you have that for life. When it comes to night creams, we joke probably much like you guys. We get a lot of things sent to us for free. I don't know many dermatologists who use like $900 night creams. Honestly, we use retinoids. We use prescription strength products and ingredients. And so I think a lot of it's based on again what your issues are. If you need something for pigment, something for aging, just something for good skin health, I think it depends. But I think the hardest thing to kind of separate sometimes the marketing that goes into into the products that kind of lead you to a certain direction.
Thank you. Moving over to acne, cystic acne, you're a real expert in that. What recommendations would you have for our viewers out there and best practices in dealing with that?
Sure. So I always start my base. So you always want to exfoliate out because why do you get acne? It's because you have these little pores that get clogged up, right? So having a good exfoliating product, usually like a 2% salicylic acid is great. I do like glycolic and lactic acids, but with darker skin types like I'm sensitive to a lot of things. So glycolic is it's one of those ones you have to kind of work up towards like the higher strengths. Lactic acid is usually pretty good. I usually start with exfoliating everybody 2 to 3 times a week. Again, 2% sal acid cleanser. Neutrogena, all these companies have pretty reasonably priced ones. I then move towards actually therapeutic things like prescriptions. So you can always do over-the-counter retinols, which are great, but we kind of go, again, a little bit higher up to the prescription retinoids. Usually we start at low doses, like 0.025% or so. And over time, we work up to about a 0.1%. A lot of that becomes, again, how much you tolerate it, but that's your like base. Once you have that in place, your retinoids are helping with your texture, your tone, your scars, and obviously your acne as well. They also happen to help for anti-aging, so it's a good side effect. And then I get a little bit more creative. For my female patients, we talk about spironolactone. It helps with androgen, so like your hormonal aspect of acne. It's one of those ingredients that I give to a lot of patients for different reasons. I also use it for hair loss as well. And so we kind of build a plan based on how aggressive it is. If it's true cystic acne, I sometimes laser my patients to get them better faster, especially if they're getting breakouts quickly. We do Accutane. I have a bunch of virtual Accutane patients right now. In New York, everybody has to be perfect. So, we Accutane is the only probably curative thing out of all these options. And we have a lot of patients who are on low dose Accutane just for work purposes, a lot of entertainment people and actors and actresses. So there's a lot of different ways to go about it. If you're having any kind of scarring though, I mean, I'm biased, but I think it's important to see a professional and see a board certified dermatologist that can kind of guide you to not just short-term improvement, but long-term.
Outside of lasers for in-office treatments, are there anything else that you would recommend?
It depends. I mean, again, it's about, some people do red light therapies. They have those red light masks. They do help. It's a function of how strong we can get in the office. We have a little bit stronger at home. You can definitely do it. Again, there are masks you can do at home, like the clay masks. They help absorb. There's something called kaolin in them. It's a type of clay that actually absorbs a lot of debris and the junk that's kind of in the pores, clogging them. And so a lot of different options there, but it depends. Like I said, if you're having cystic acne, you have to see a professional. At home, though, my favorite kind of hack is we tell patients to put a little bit of benzoyl peroxide and a little bit of like hydrocortisone, like a over the counter on a Band-Aid, and put it on the pimple at nighttime. And by the time you wake up, usually it's a lot better.
We have a question from one of our viewers, and thank you, by the way, for all of that input. She wants to know if you would mind talking about facial massage and whether or not you recommend it. If so, can you give any tips?
Sure. So facial massages are fun. They feel good. I'm a big massage guy in general. So it depends. My whole thing on everything in life is be factual and scientific. I think, again, there's a lot of like they have like I think face gyms and things like that now. You got to think about short term, long term, right? And I think they do help in the short term, no question. So if you have an event tonight or something in a couple hours, I think it does help in terms of doing lymphatic drainage, which means you're shifting the fluid a little bit in your face, or you're less puffy and you might have a little better of a contour. I think long term, there's not really any good evidence that long term they do much of anything. And so it kind of depends on the situation. Again, if you have something you need to take care of right now, it's fine. But if it's a solution to a long-term problem, I'd probably look for other options. And even with things like my favorite, one of my favorite kind of things, we announced something yesterday with Martha Stewart, because Martha's a patient and a friend, and she loves the jade roller stuff. And I always tell her, like, Martha, well, I'll just give you a spoon, put it in the fridge, we'll call it a day. It's the same thing. It's not a big deal. So, a lot of people, they love jade rollers feel great. And again, it's really just a lymphatic massage, but a spoon, an ice pack, all these things can kind of help too, depending on how much force you apply on there. So it really is dependent person to person.
Thank you. We have a question from Devanshi Masrani. She says, hello.
Great to see her.
Thank you. So she's asking for darker skin tone. She has Indian skin.
Mm-hmm.
What would you recommend that she use for a daily and nightly skincare routine? Serums, retinoids, vitamin C, anything?
So darker skin types tend to be more reactive to vitamin C, so you have to start low. Again, the ferulic CE from SkinCeuticals is amazing, except I can't tolerate it at all. And a lot of darker skin types, for whatever reason, we have issues with it. So they have like a fluoretin CE, I believe, from SkinCeuticals, which is also pretty good. But the antioxidants are kind of like icing on the cake. I still think whether it's pigment or aging, you have to be on a retinoid. Literally, if you Google Holy Grail anti-aging, it's always going to be a retinoid. The only kind of thing that's come up more recently is there's something called bakuchiol, which is like a plant-based alternative that might have some similar properties to a retinol, and it's not irritating at all. But the retinoids are, if anything you get from this webinar, it's make sure you get on a retinoid in some way, shape, or form, because it doesn't matter the skin type. And darker skin might have to start, it might need to start a little bit lower at a dose, but the retinoids are going to help you texture, tone, pores, wrinkles, scarring, dark spots, light spots. I mean, it's a vitamin A derivative too, so it's safe. The only time we hold off is if somebody's trying to get pregnant or pregnant.
Thank you. Also, what if you have someone out there, they're having trouble with their hair falling out right now?
So interesting.
What do you recommend?
Yeah, our virtual visits right now, we're actually seeing an uptick in the amount of hair loss, and also a lot of acne breakouts. I think right now it's interesting because even if we all feel fine, like everything is, like we're okay, this is crazy going on, but like we're okay, our body sometimes reacts to things, right? And it's natural for your serum cortisol to go up because you're stressed, right? It's a stress hormone. If your serum cortisol levels increase for a longer period of time, then we do see things like breakout, more oil secretion, and we do see some hair loss too. Again, short-term, long-term. In the short term, a lot of our patients, we give them light, like steroid drops. They're anti-inflammatory that kind of calm everything down. It's kind of a short-term fix, but we've noticed a lot of people stop shedding as much as they were previously. And it's a similar equivalent to when I do sometimes steroid injections into people's scalp. If they're continuing to lose hair, we have options, right? So one of my conflicts of interest, I used to be the global derm for Rogaine. And so Rogaine is just minoxidil 5%. It doesn't matter if you use Rogaine or any other minoxidil 5%, that's something that can stimulate hair growth. The problem is that you need to use it kind of consistently and over time. So the best way to explain hair loss is that you have this car, and this is your genetics, and it's going downhill, unfortunately, right? And you're losing hair. So there are things like minoxidil that can stop this car and maybe push it back a little bit. And then for males, we use finasteride. For females, we sometimes use spironolactone. The issue is, if you take off the brakes, does it get worse? Probably not, but you start going back downhill to where you were. And so we like to look at different options for our patients. We do a lot of prescription topicals. Also, we do a product called Hair Stim. It's, again, conflict of interest, but we helped develop it. But that's a prescription, higher dose minoxidil, topical finasteride. And what we usually do is we get our patients to grow. If they get to a good point, we don't have them use it every night. We have them use it maybe twice a week or 3 times a week just to maintain it. So we've had patients do really, really well. But, it depends on how aggressive you need to be. And they have, things like PRP and all that stuff that we can't do right now, and even transplants. But I think at home, easiest fix is just to do a minoxidil and make sure you use it every night. And obviously, again, virtual visits would not, it doesn't have to be me, but your local dermatologist can kind of prescribe something, especially the steroid drops that I think I prescribed 3 times already this morning, because there is an uptick in hair loss because, again, there's this weird stress that's kind of going on right now. So we try to be super honest about, look, like it's choppy waters right now. Let's get you back down to like the calm waters once everything settles down.
Wonderful. We have a question from Paige Master Andrea from Haute Living. She says, hello. She wants to know, what can we all do to keep our skin tight and bright? What specific products would you recommend? I know you went through a good at-home care regimen at the beginning.
Yeah, so again, my retinoid's always the base. That's always going to be forever and forever. It's tough, so like, okay, so if you think about, if you want things tighter, right, why do they not become tight, right? You break collagen. Collagen's like your building block for everything. It's like your cement that holds everything together, your base, right? And your pores that are on top of it. So your pores are a fixed diameter no matter what. And what happens are that these pores get clogged and you start expanding. So your pores look larger, your collagen breaks down in between the pores, and things look more what's the word I'm looking for? Like just kind of softer, right? You get the jowling and everything. So the number one thing you do, again, you stimulate collagen. Collagen, you'll always have your retinoids as the base, but you can do things like at-home microneedling, which, they're not obviously at the level of in office, but it's something to do that actually does stimulate collagen. It's actually called collagen induction therapy, which is where microneedling actually came from. So that's a great option. Again, exfoliating pretty regularly, keep those pores clean, making sure they're okay. And then, there's other things you can certainly do. I mean, it's super cliche and I apologize for it, but I mean, I think just being healthy, right? So sleeping, letting your body heal at nighttime, exercising, getting good blood flow. it sounds like super cliche, but it makes a difference. I mean, if you sleep 8 hours a night every night for the next 2 weeks and you work out every single morning when you get up, you'll look great, right? Like we all know that. That's something um, that's very like it's consistent, right? And we all know, we just don't do it. And so a lot of this is based on our ability to kind of hold the fort, if you will, and to be consistent with it. And I think once we develop those habits, we do really well. But if you're doing, I mean, again, we, whether you're doing like cosmetic procedures in our office, we're doing, we like to do lasers. I have a pattern with a lot of my patients where we'll do lasers like, once a year for like much more like downtime, but like much more significant results. We might do some maintenance lasers or even quick lasers before like a red carpet or a birthday event or anniversary or something like that. So we mix and match the physical in the office, but obviously right now we don't want anybody coming in for any cosmetic procedures. We want to just make sure people are just taking care of themselves at home.
Thank you. Are there any specific retinoid products that you would recommend?
So it depends. The retinols over the counter, there's a lot of good ones. PCA makes great ones. SkinCeuticals makes great ones. Neutrogena has a pretty cheap one that's actually, it's great. It's like almost like a retinol oil, which is good for sensitive skin types.
Neutrogena?
Yeah, they have some good ones. It's
over the counter, right?
Over the counter, yeah. So when you're moving to prescription, you have your options. So there's a lot of different ones. Most of them more for acne. Again, we compound everything. So there's a skin medicinals as a compound we do. So if I'm looking like, let's say at you, and you're telling me, I have redness, I have some dark spots, I might compound a tretinoin, which is a retinoid, a 0.025% if you have sensitive skin. It might go up to 0.1% if you tend to have more oily skin. I might add in vitamin C and vitamin E, and then hyaluronic acid if you tend to get a little bit of flaking or some dryness in certain areas. And then you can add resveratrol as an antioxidant there. Like there's a lot of ways to compound it, but physicians in general, I think whenever you go to your dermatologist, they can prescribe whether it's a compounded one or like a Retin-A 0.04% or 0.06%. But the biggest thing is people they jump off a bandwagon real fast if they have any kind of issue. A lot of this stuff is based on developing, having your body develop a tolerance for it, right? So you start slow, like a retinoid, even over the counter, take a pea size amount, you go 1, 2, 3, 4, 5. One pea size for the whole face is all you need. You rub it in, and you start that up every other night or every 3 nights. And then as you work your way up to every night, you start seeing the actual results, right? And again, vitamin A, so it's something that is not bad for you by any means. You see all these things on the internet about like, oh, it thins out skin. Actually does the opposite. So it's about trusting your doctor, your dermatologist. But for us, that's what we do personally. So I think the best thing in life is like, what do you do for yourself or your family? And that's what I force my sister and my family members to use as well.
Thank you. Any quick tips for viewers for acne scars? Anything that they can do themselves or come in to see you for?
So that, I mean, unfortunately, acne scars are tough. The retinoids, again, based for that too, but it's one of those things where it depends. There's one of the things I'm very, very, very aggressive, both in media and press and also in real life. You should always see an expert, right? And again, there doesn't have to be me, but it has to be somebody who's trained in this stuff, especially if you have ethnic skin, which we see on average in our office, maybe 3 or 4 a week of complications from med spas and places there. And not all med spas are bad, but there's a lot of times where people just aren't trained in ethnic skin, right? And you have to see an expert. When we look at scars, we look at a few different things. We look at depth. You can have kind of broad scars, which actually sometimes look worse, or the ice pick scars, which are very deep, but they look very narrow. How we treat it's based on the skin type and again, the depth. For certain scars, like I have a laser behind me, it's my erbium laser. That's like the beast, I call it. It's resurfacing. The treatments are very bloody and crazy, and it looks like a mob scene after you're done. But those things are really great for aggressive laser treatment. The caveat being, the more aggressive I am, the more the downtime is, right? So I tell people, look, like plan for the worst. A week or so, you're not going to go out to public. You're just going to hang out at home. Ironically, good time right now, but it's one of those things where you're essentially resurfacing the skin. We do fractionated treatments. People have heard of Fraxols and Halo. Those are great for kind of medium, so medium scars, medium depth. Also, if you can't do downtime more than 3 or 4 days, it's a good option for you. And then we do lighter ones. So, again, the blessing and curse of having a patient population that has a lot of busy meetings. They might be, Fortune something CEOs or actors, actresses. They can't have any downtime because they're always on camera, always doing this, that. So we have a Genesis laser, which is more just heating, and we treat it kind of by bulk heating, which stimulates collagen. That one might take 10 to 12 treatments, whereas a erbium might take a couple, maybe 2 treatments or so. So we kind of have to look at all the different processes there and figure out what's right for that person. And then again, with darker skin types, I can't quite use the erbium the way I want to, as aggressively as I want to, because you worry about hyperpigmentation or darkening of the skin afterwards. So you kind of have to finesse it a little bit, patient to patient, figure out the right one. And with our office, we're lucky that we get some cool lasers and things that we get to test out before anybody else. So we have some lasers that we're kind of helping develop right now for companies that might be safer in darker skin types. But that I'll let you guys know in a few months, because they look good right now, but again, I have to be a scientist first. So it doesn't matter if it looks good right now. I want to see in 3 months or 6 months, is it, kind of holding as well? And is it still something that's very legitimate?
Thank you. So this is a question from Susan out of Destin, Florida. She wants to know if you can go back through the Band-Aid tip. Yeah,
sure. So it's a quick tip. I do it myself too. So you take a Band-Aid, you put a little bit of over-the-counter hydrocortisone, and then benzoyl peroxide. It could be 5% or 10%. You can put it on there, and then you just apply it at nighttime to the acne lesion, and usually it looks a lot better because the benzoyl peroxide kills the bacteria in there, so that whitish little pus mark that would be in there. And then the hydrocortisone helps with the erythema, the redness and swelling. They also have those like new acne pimple patches. They actually work. Surprisingly, I will be first to admit that I was a little skeptical when I saw them, but they have this colloid barrier that actually absorbs some of the fluid from from the lesions themselves. So it's a quick tip. We recommend it all day long. I mean, our patients tend to love it when they're in a pinch and they can't make it to the office. But otherwise, in the city, it's not uncommon to have like 15, 20 patients a day popping in just for a little like injection to an acne cyst or acne bump, and it takes 2 minutes, and they head out and continue the rest of their day.
Great tip. Thanks for going back through it. Is water really a skin-saving hero? A question from a viewer.
So it's not so as a doctor, yes. But as a doctor also, no, because I think people are like, look, it's gonna, hydrate you. There's other things you have to do. I think it's just good form to have, the recommended amount of water a day. I'm a fitness guy, so I love working out all the time, and it's very easy to be dehydrated. Even right now, I mean, it's very easy to be dehydrated because we kind of lose track of what we're doing. We have coffee, we have this, we have that, and we're forgetting that the basic, essential in life is hydration. And so, do I think it's going to move mountains? No, but I think it's necessary regardless, or you should be doing good practices. But I think hydration is in twofold, right? So like I have in my bag on my desk right here in my office, I have moisturizers always, right? So hydration, water inside the body, good for other things. Also external hydration for your skin, it doesn't matter if you're not dry or not. You have to think about it. Your skin is taking a beating every day. It's facing the world. It's facing the pollutants in your home, your pets, everything, right? And you want to nurture those skin cells because, again, over time, the elasticity, all that stuff starts going down because you're stretching, and you're breaking that collagen. So when you hydrate it and you do things like that, you're nourishing that skin. It's like, why wouldn't you want to protect that number one asset, the largest organ of your body that's protecting you all day, all night? And the thing people forget about is it's very easy to get an infection, things like that. Even like basic stuff now, we're talking about the virus. Like, what's the best way to do it? Have a barrier in place, right? If you have open cuts and things, not to say the virus is specifically going that route, but you can get bacterial infections and things like that too from just not having moisturized skin. And so there's a second layer to why we recommend this stuff. And I think a lot of this is based on our intention for patients just to take care of themselves. And then the wellness aspect of it, I think, also helps too.
Thank you. We have another question from the audience, Rima. Rima wants to know what causes dark spots. And I know you touched on this a little earlier, but what's the best treatment for those dark spots?
It could be a lot of things, so it depends. So dark spots can be hereditary. So in darker skin types like my own, like Indian skin, we sometimes get a hereditary pigment around the eyes. You can get melasma. Melasma is super common down in Florida. You guys see it like all day or all night. I used to joke, I have a BBL laser here, but we had one down in Miami when I was practicing down there. And it was like a factory. I think I would see like 15 or 20 a day. And I would just, as they say, I would reverse the damage into the sun that most people make during the summertime. But so melasma is it's an unfortunate disease of pigment, right? So your pigment cells are more sensitive to UV, and a single bad day in the sun can cause these little pigment cells to secrete pigment that sits at the top of your skin layer. We look at topical options. We can compound medications for that. If it's not working well, we need a speedy thing. We can sometimes do lasers as well. You have to be careful again with lasering because a lot of lasers make pigmentation worse. And so it really depends on what the skin type is. Is it true melasma? Is it dark spots? There's like lentigos, which are sunspots. You can have seborrheic keratoses, which are like hereditary, special type of almost like what's the best way? Like, I think you say like Morgan Freeman has a bunch of what we call DPNs. It's a genetic kind of thing that your parents pass along to. So that's treated a little bit differently. So you have to kind of figure out why you're having the pigment, melasma being most common. And I tell all my pregnant patients or those who will be getting pregnant to always wear sunscreen because it's very common to see that quote unquote mask of pregnancy where you get pigmentation here on the forehead. And then again, depending on how aggressive we get, we can certainly get people better. But my belief is always prevent it from happening in the first place. That's a much better treatment than having to chase it afterwards.
Thank
And
you.
you have to, and then sorry, I have to say as a dermatologist, you have to wear sunscreen every day. So even like right now, I have a lot of windows in my office. There's still UVA hitting me all the time, so that definitely does still play an effect on my skin. Even though we're indoors right now, you should still be wearing sunscreen. UVB is the one that causes more of the sunburns, but UVA can be just as dangerous if not protected against.
What SPF do you recommend for
So
people to use?
I think anything less than 30 is a drop in the bucket. It's not worth it, honestly. And I've told it to every skincare company whenever we formulate anything that I refuse to support any product that has SPF 15 or 8 or whatever these people do these days. So 30 is your minimum. If you're going to be at the beach, I'd say 50 or above. There's all that controversy about does it make a difference over 50? My whole thing is as long as it doesn't hurt, like let's just do it and get as much coverage. Because the problem is, and this includes people like me as dermatologists, most people don't apply enough, right? And most people don't reapply. And my dumbest story ever is I wanted to see if I could get a sunburn when I was in med school. So before a dermatologist, and I was in I think like Key West or something on break, and I definitely sunburned hardcore by playing basketball for a few hours outside, and I learned a very valuable lesson. So it doesn't matter what your skin looks like, or how dark it may be, or anything. We're all unfortunately susceptible to the sun, whether it's for pigment, whether it's sunburn, skin cancers, aging. There's a lot of different reasons to wear sunscreen.
Thank you. Moving over to diet, we did touch on diet does play an impact in proper skin health. What's the diet that you would recommend to someone?
So it depends. I think a lot of the stuff now people are going vegan. They're changing stuff. So I'm personally vegetarian. I'm not vegan, although it's something I'll probably move towards soon. I think with any diet, think about kind of what you're doing, why you're doing it, how you're doing it. So anytime you switch anything in your body, you can expect a change, right? Your body's going to react. So going cold turkey vegan and from a carnivorous diet is a little bit challenging to your body, right? Because it's going to be like, what's going on? You might notice increased breakouts, hair loss, all these different things because your body's kind of in a shock system, right? Shock state. I always tell my patients to kind of gradually transition into it. There's the diet part of it's interesting to me. So I'm a scientist first before anything else. I think we don't know enough about diets, and it's very specific to the person. So there's something called genomics. Genomics are this is a very crude example, so I apologize for the analogy. But so like for a long time when we would treat cancer, we would just give chemotherapy and we would just kind of blast the heck out of everything in sight, right? And we'd hope to God we'd kill the cancer. Then over time, people find, oh, let's take a piece of this cancer. Let's look at exactly what mutation exists and figure out how do we treat this specific kind of cancer, right? And that's how modern cancer therapy is dictated today. So I think whether it's diet or hair loss or anything, eventually we're going to look at that model where like, what does this one person do differently than the next person? How do we specifically address them? Maybe you and I have, we have the exact same meal and we perform differently, or maybe I gain some weight from you, you lose some weight. There was we had this fun conversation. So there's Draymond Green of the Warriors. So Dre is a friend, and we had this conversation about how nutrition affects athletes. So he and I think Steph Curry had this interesting kind of thing. We're looking at each other's diet, and they would have the exact same meal at like noon before a game at like 7 p.m. And Dre was saying that he would have like X number of more fouls per night. He'd be much slower in the fourth quarter. He'd have all these different issues, and he'd have the exact same meal, exact same everything as the other guy who was, 20% more points, less fouls, more active, his breathing less heavily, like all these different things. And what it really showed us was, and we were looking at this through a scientific kind of lens, that every person, they digest things differently, they process things differently. And I think the next kind of frontier in health is that personalized aspect where at some point, whether it's a swab, whether it's a DNA test, whatever it is, we're going to look at how nutrition affects us. And there might be certain medications and certain things that are specific to us that might not work for other people. And the only caveat with this and nutrition is that my rosacea patients do flare a lot. Rosacea is essentially an inflammatory kind of, I always say cousin to acne, where you can have breakouts, redness, things like that, but it's more, again, inflammatory, less the bacteria and the oil-based reason why people get acne. And rosacea, people trigger things like spicy foods, caffeine, alcohol, the good things in life, chocolate. And a lot of my patients who are not getting better with their acne regimen, it's because they don't have true acne, they have rosacea. And I actually have a little bit of rosacea. I get a little bit of redness and a breakout or two if I'm traveling, giving talks, and if I'm staying in hotels for a bunch of time. So diet can, in specific instances, play a much bigger role. But on a personal level, scientifically, I think we'll in the next 4 or 5 years realize that there's a lot more to it than just saying go on a keto diet or go on a paleo diet. It's going to be more like, you, April, should go on this diet. Me, Dhaval, should be on this diet. And then we kind of figure it out based on that. And that's I think that one missing piece that we haven't quite pieced together, again, for dermatology, but also for the rest of health.
Thank you. You've worked wonders with men's hair loss. What are the specific treatments that a man can have done?
So I appreciate the kind words, but so hair loss is tough, right? So we got to figure out why people are losing hair. So we always check blood work first and foremost. Indian skin like myself, my vitamin D is always going to be low. So I always start everybody regardless, but everybody on vitamin D, 5,000 units every single day. I think it's just good for your health. There's some controversy in some of the older studies, but not necessarily the knowledge behind the studies. And so I think I recommend it to my family. I'm not worried about it. I think ferritin can also be low. So if you're breaking hair, like your hair's, you'll grow, then break at a certain length. I think ferritin is your iron, iron levels kind of crudely measured. I think your ferritin level something should be examined. We look at thyroid levels. We look at medical causes. I always tell the story. I once had a patient who came in who I loved to death, and I would see her every few months for something different. And she came in once, she's like, my hair is falling out. What's going on? We need to do something. Like, I want to do this, and this. And I'm like, no. Like, something's up. Let's go. And I saw her 4 months later, and she had a double mastectomy. And we found out she had breast cancer, and her presenting sign was just hair loss. And so you always, whenever something is happening at a very rapid pace, you should figure out why it's happening at a rapid pace and kind of adjust on it, right? Beyond that, assuming that the inside part of it's all okay and we check the vitamins and everything else, we start looking at other options for why people are losing hair. And if it's genetic, fine, and we start, addressing it as such. If it's stress-induced, whether, with women, a lot of times they lose after pregnancy, they lose, we call it or postpartum hair loss, telogen effluvium. And so there's a lot of different reasons why we do it. For males, a lot of times it's just female or male pattern hair loss. We just lose hair. Again, myself, I definitely used to thin a lot more. So we look at different options for them. So we always start with, have you taken minoxidil, finasteride? The one thing I have to always say as a doctor with finasteride, oral finasteride, is there's a lot more evidence coming in that we don't know a lot about it. There's some sexual side effects that people know about, and then gynecomastia, which is some increased fat in the male breast tissue. We're seeing more and more reports about anxiety and depression coming from these medications. It's something I ask my patients about. The literature is early, but I always tell people, like, I have to be a good doctor, right? So tell me, how are you? How's everything going? The more you ask, the more you learn. And we definitely do see it with patients. But that being said, these are options for hair loss. We have, again, the prescription, the hair stim is one of the ones that we have developed, but that takes the topical version of these finasterides to essentially minimize chance of side effects, although always possible. And we look at higher dose minoxidil. We combine it with things like retinoic acid, which can help with penetration. Hair stim does well. There's thousands and thousands of people around the country who do really well with it. We have something called PRP. PRP is kind of fun. It's when we take your blood, we spin it down, we get all the good growth factors and inject it back into your scalp. It looks kind of crazy. It sounds kind of crazy, but it does work. But again, always scientists first. So things you should know. 20% of people get an incredible result, right? Like you're like, Jesus, like I cannot believe it, right? 20% of people get a like okay result. And I always say, like in my office, we've had I think 2 of them that I haven't been happy with. They were both happy, so I will give you like that quality. But I personally didn't see much of a difference, but they felt like their hair was thicker. There are studies that support that PRP does thicken hair a bit too, and it obviously increases the amount of hair you have. I think the rest of the people, the 40%, get a good result, maybe 10 to 15%, which is a lot depending on where you kind of start. But I think it's important to start with expectation. You can't really be a salesperson. The best hair patients are the ones that become kind of like family. Like, look, we're going to try this, this, and this. We're going to keep elevating based on what your need profile is. And, my goal is always to get people away from transplants. We're going to be doing transplants in my office, but if I catch you early enough, I don't want you to go that route. They're expensive. They're still a little bit more barbaric in terms of how we do them, but they're an option. They do work. I mean, but again, if I can do everything I can to prevent you from getting that, I do try to do that. There's other things that we talk about doing. Red light therapy we do in our office. If there's an anti-inflammatory effect of red light that potentially can stimulate some hair follicles. It's kind of like those caps that people wear for hair loss. They work, but at home it's not maybe as powerful, so we don't see as much of the results. I'm lucky enough to be in some of the testing for some FDA, well, they're not approved yet, but soon to be FDA approved procedures that are coming out for hair loss as well that are not necessarily PRP, they're not necessarily transplants, they're somewhere in between. We can stimulate new hair follicles. But for me, again, science. So we got to make sure it hits all the tests to get all the results before we can actually recommend anything. And I think the biggest thing is, we're lucky to see a lot of hair patients every day, but relationships are important, right? So again, you never start a hair consult as a salesperson. You start as a friend, and you're like, look, these are our options. These are the pros and cons of each different thing we can talk about. And the vast majority of our patients do really well with small little kind of interventions. And then if we have to escalate, we escalate. But I think, again, setting that expectation is usually the best way of going about it. And I think if we have a clear-cut plan, people do really, really, really well. But it's kind of the kind of haphazard part where we get in trouble. And, our patients, I love them to death, but they're always honest with me. And so they tell me if they're not compliant, they'll tell me real quick. So, which is kind of why I love them, too. So we figure out what works, and then we kind of go from there.
Thank you. For moles, we have a viewer that's asking, what do they need to be looking for in monitoring moles?
So there's the cliche A, B, C, D, E's of melanoma, which I love. So A is asymmetry, B is the border. So if it's a little jagged, you gotta come see somebody like me. The color, so having a little bit darker area on a mole is not necessarily bad. It's still worth checking, but it's not, it's not something that I look at and like, oh my God, we have to take it off. I think when you look at color, there's other shades. If you see reds and browns and blues and grays and all that kind of stuff in a mole, see us quick. Diameter, so anything bigger than a pencil eraser. And then E is the most important in the ABCDEs, is evolving. So if anything is changing. So a trick I have for all my patients are, if you're worried about a mole, take a picture, right? Set a little push notification in your phone for about 30 days. Take another picture. If there's any change, come see us, because the idea is that you can pick off skin cancers very, very early, but you have to look, right? And if I can flip through some pictures on a phone and look at, because the biggest downside of what my interaction with a patient is, I see you, let's say today, April 21st, right? I don't know what it looked like. It could be still benign right now, but maybe on May 21st, it won't be. And that's because something is evolving through the progression. So maybe between like February 21st and April 21st, it's been changing. It's still not bad, but it's moving towards it. So we can kind of take something off before that happens. And we've been very lucky, so knock on wood, but our last 20 or 30 skin cancers have all been very superficial, so they haven't gone deep at all. And I think it's because A, my patients are amazing and they know to do this kind of stuff. And then also two, the motivated patient looks, right? Like you have to check yourself out, have your loved one or whoever else just check and say, hey, is there any weird moles or anything like that? Or probably more pertinently, come see us, right? Where we have patients, we check in at least once a year, maybe twice a year, depending on history. And we just check. It takes 5-10 minutes. Our patients are all like family, so we hang out and we catch up and we just make sure that nothing is changing. But I have my patients do a wellness week every year where they go see their OB-GYN or they see their GI doctor. They'll come see me. And we just check box and make sure everything is okay. But wellness is not just mental health; it's physical health too, right? So we want to make sure that we take care of everything.
Thank you. We have another viewer question. He wants to know if you're seeing an uprise in cystic acne in men? And do you have treatment specific for men?
Yeah, so we're seeing, there's a lot of things that we're seeing more of right now. So because of this virus and everybody's at home, we've actually seen some specific viral trends in skincare rashes. We just did a media piece this morning or a media interview on it, but there's some certain rashes we're seeing because of this virus potentially. But then just general things we're seeing with patients on our virtual visits, definitely more acne. Again, we're all stressed, so our serum cortisol levels are going up, and there's definitely more breakouts occurring. I also think guys are now starting to figure out that it's okay to go get these things checked. So outside of this whole what's going on now, in our office, we're seeing a lot more male patients come in. I think, I'm a sweats, backwards hat kind of guy on the weekend watching sporting events, as you guys know. But I think for a long time, we were kind of embarrassed to go to a doctor and talk about how our skin looks, acne, that kind of stuff. We kind of be like, all right, we'll use this all in one body bar, hair cleanser, this, that, all that stuff. And it wouldn't get better, wouldn't get better, wouldn't get better. So now we have a lot of males come in, and then we usually put them on a regimen very similar. And it actually is not that much more different than our female patients, with the only caveat is male skin tends to be a little bit thicker. So I usually can go a lot more aggressive, faster with the prescription strength ingredients.
Thank you. Another question from a viewer, from Jessie. She wants to know how she can treat surgery scars. She has a darker skin tone. Her scars turn dark. Any treatment to help lighten them?
Sure. So a couple things. So with those patients, there's not an exact science. So the interesting thing about scars, so actually early in my career, we had a big scar case that went a little bit viral, kind of by accident. It wasn't meant to be for media or press, but it kind of went far and wide. And it was actually kind of and I'll be very truthful and honest, it was kind of us looking at the person, being like, what do we need to do? We can't. There was a patient who got slashed across the face, and traditional dogma would be wait 6 months to treat a traumatic scar or surgical scar. You can't have a 20-something-year-old walking around in New York City with a scar for 6 months. That's just not possible, right? So I actually recommend, and now it's become a little bit more accepted, if you have a scar, make sure you get treatment on it fast, right? So if it's lighter skin types, I usually laser or do whatever I need to do, like almost immediately after the sutures are taken out. And even sometimes when I'm putting the sutures in, I might do a laser, a quick treatment of laser, and then suture on top of it to get a really good cosmetic outcome. For darker skin types, sometimes I actually start them on like topical steroids or things like that at the periphery of where the scar is, to start minimizing the anti-inflammatory or the inflammatory effect that the pigment is generating or the result of. So what you have is, it's called post-inflammatory hyperpigmentation. So after you've had this, whatever it is, surgery or cut or rash or anything, your body secretes pigment as a result. So sometimes we do steroids quickly thereafter to break up the pigment, break up the inflammation there. If that doesn't work, we have a lot of lightening creams we can use, starting from over-the-counter 2% hydroquinone creams, like Ambifade cream, to a little bit stronger prescription strengths like 4% or 8% or even 12% in our offices.
Thank you. What do you foresee ahead in the beauty space when we start coming out of quarantine, when your office is back open?
So, our wait list has become very large for our procedures. I think a lot of people want to get back in for that, but it's going to be interesting. It's a good question. I feel like the world right now, it's so different. The way I think we prioritize everything has changed a little bit, and we're becoming a lot more amenable to being okay with ourselves. And I think in a weird way, imperfection is perfection, and I kind of like that too. And given my job, maybe that's not what I'm supposed to say, but like, humanity first, right? Like I kind of like the idea of accepting you for how you are, and that everybody being that way, right? So I think in general, people are going to be like, your cosmetic patients are going to come back in. That's okay. It's part of their, in a weird way, I think it's part of the routine, and it is something that's like kind of going back to way you felt before, and it's normal, and it's okay. But I think in general, I have a strange feeling that in the cosmetic space, I think there's going to be a change. I don't think the super luxury skincare market might do as well as it used to do in the past. I think people are going to be more kind of just mindful of purchases, obviously for financial reasons, but also just regular. I think people are just like, look, I don't want the fluff. I just want to have a good, solid routine. I want to take care of myself. I think mental health is going to be a much bigger priority than maybe other parts of our wellness, which is fine. I think it's fantastic. I think a lot of these, and I say this with a smile on my face, but I think a lot of people will take doctors more seriously and what we kind of preach. in a weird way. I think, in a humanistic way, I think people now understand why doctors do choose science and why we do harp on certain things and why research is important and that kind of stuff. I think that's going to take a little bit more cred, if you will, amongst purchasers. And I think a lot of companies are going to become more digital. I think how we consume information is going to be a lot more digital. We're putting, my goal is to keep telemedicine as part of my office now moving forward, right? We kind of, in medicine, we're very resistant to change. And so you never really saw it happen, but now we have to have it happen. So, it's good. Sometimes you need to get that push to get there. But like, I don't think people should have to come in and miss work or school to see me for 5 minutes, which happens pretty frequently. And I think if we can create kind of a nicer setup where we can connect like this virtually or whatever it is, I don't think it's a bad thing. And I think more people will be able to care for themselves. I think we have to be more mindful again of the finances. I think if anything, we all learn that we have to be smarter about how we spend money and maybe not waste it as much as we sometimes would. But again, I think humanity is going to be a little bit different and for the better, I'm hoping, because we're just going to be all more connected. So, if somebody, I remember I've had patients who are like, I want to get rid of my freckles. And now, the same patients love their freckles and I love their freckles. So it's like, again, I think, in a weird way, our priority is going to shift a little bit and I think for the better. And then we're here for whatever we need. My job is, my patients know this. I'm not very big on being a salesperson. I'm not very big on, I actually think it's weird to try to sell somebody on changing themselves. I think it's a very odd concept, right? But I think when you can make somebody feel better about themselves, it's an addicting and very powerful feeling for both sides. I joke, but I always feel like I get more out of it sometimes than the patient does because I just feel so happy when I see them happy. And I think when the comfort level of a lot of this stuff, as people look to feel like themselves, it's going to be really interesting to see how that goes. But, I think as we were shifting already to more subtle things, I think now more than ever, it's going to be more about like keeping you and being fine with that. And again, I will never be against that in any way, shape, or form.
Thank you. Viewer question. She wants to know what a good cream is for the 25 to 35-year-old age group for anti-aging. What do you recommend?
So 25 to 35-year-olds. So I would still get a retinol. I know I say that a lot, but I would find one of the ones like, again, SkinCeuticals has great ones. PCA has great ones. Roche-Posay has, I believe, some really good ones. If you can't get a retinoid prescription, I think La Roche-Posay has adapalene, which is a very light retinoid, which actually does work really well. So I would probably get that adapalene over-the-counter retinoid combo that La Roche-Posay has. I think it's like $30 if I'm not mistaken. But it's a great way to start, and then you kind of escalate your way up based on when your skin is ready for it. But it's fun. But it's actually, like I said, we have that thing with Martha later today. But I asked Martha a long time ago because she's like the beacon of aging. What's the one thing you wish you did more of, like, back in the past? And she said, wear sunscreen. So I have to always push that as well, because, a little bit of sunscreen now will really, really make a difference later in life. So it's something we can't see every day, but 30 years from now, you'll really thank me if you start doing it, I promise.
And I think it's important too, you touched on the, SPF endorse as well.
Absolutely. I mean, we're not immune to it. I mean, the glass is glass, right? We're still going to be subjected to lots of things. And at the very least, so I use like a pretty cheap Aveeno with SPF 30 in every morning. It has soy in it. So soy actually lightens up dark spots. So I like it because if I get a little blemish, it clears it up. It's like, I don't know, like $6 or $10 cream. I've been using it for like 7-8 years, something like that. It takes half a second to put it on, right? So you should just put it on. It's not something that you're adding additional steps or anything like that for, so it's worth it.
This is an interesting question from a viewer. She wants to know, is it true or is it a myth that lasers on the skin cause cancer?
So I hope that's not true, because then I'd be in a lot of trouble. But no, I think, UV over an extended amount of time can certainly cause cancer. And we do UV therapy for certain people, like certain skin cancers, certain psoriasis, different kind of skin cancers, but psoriasis, eczema, those things you have to be careful and everything in moderation. Traditional lasers, so how they work is if your skin is like this, right, we can actually target how deep we're going. And so there's been no evidence that I've seen that these lasers can cause cancer. And actually to the opposite, we've seen that these actual lasers can treat basal cells and squamous cells and things like that over a period of time too. And it's something I'm very interested in my own personal research that we look at a lot. But And even like the BBL laser I use. So BBL is the most popular thing we use for like lighter skin types with darker pigment. Like if you have sunspots and all that, like the BBL is literally part of I used to call it the South Beach laser because again, that's the one I had the factory for where people would come in, come out, come in, come out. And we sometimes combo that with certain topical medications to treat actinic keratosis or precancers. So I would actually argue that they're protective against a lot of the skin cancer. And there's actually some studies that show that you can actually break up some actinic damage in people who have severely sun damaged skin. So while it's not FDA approved for preventing skin cancers, there is some evidence in literature published and presented that it does have benefit.
Thank you so much. What do you consider to be the gold standard in non-invasive laser body contouring?
So good question. So I am partial to, so body contouring is an interesting kind of beast. You have to, again, you can't ever be a salesperson, ever, right? So you have to set expectations. So I think cool sculpting was always going to be a tried and true leader in terms of fat, like actual fat melting, if you will, or fat loss. The studies all show two treatments, right? So everybody will kind of grab you and do one treatment. We're always science here, right? So if you're gonna, we don't actually do cool sculpting here, so I can be very honest with you. But with two treatments, it does work and it works well. But the average is about 20%. So, you know, if it's on the tummy, going 20% from like here to here, or like, sorry, from like here to here, might not be as evident from maybe the somebody's side when they're going from like here to here, right? So it depends on where you do it and where you see it. I still think it's a gold standard. We've done, you know, I do Kybella, I do a lot of things. I still like cool sculpting more. We're starting to do cool tone. We're doing some of the testing with cool tone. Cool tone's more for kind of creating that like definition. So again, I'm big into fitness, so I don't like to cheat, if you will. Like I don't believe in that kind of stuff. But I think you can have, like I do believe in hacking, right? Like body hacking, right? So a cool tone will strengthen your core, you know, X amount more than I can do, you know, as they say, 20,000, 25,000 sit-ups. I can't do 25,000 sit-ups, but if you do that cool tool, you actually can feel the strength. And the way I saw it myself, I mean, do I have better definition? Yeah. But it was really cool because, you know, when I was in the gym doing a bench press, you know, when you're doing a bench press, you feel kind of wobbly a little bit because you have these heavy weights. But if you have a very strong core, now it feels like almost the bench is wider and you feel just more stable. And that helps you do so many more exercises a lot better with better form and things like that. So you do start seeing it. We're still looking, again, the studies have been very, very solid in terms of like, does it actually work or not? Again, science is always most important. So if there's no study, I don't talk about it. I don't acknowledge it. It's not whatever, but, and I'm more interested in too. I watch my own everything, right? So how much weight I put up, how does it change, all that kind of thing. So I think a lot, that's good for functional ones. So for my crazy soul cyclers or my Peloton people, they tend to love the cool tone because it just kind of gives you like a cheat code. But again, on fat loss, I think cool sculpting works. I think all the rest of it's kind of playing catch up. And, you know, again, and I'm sure there'll be better ones that come out. But as of right now, I think most of us in derm, at least, we know that one works.
Thanks so much for that. Final question, chemical exfoliators. Who should be using them? Who shouldn't be using them? And what should someone be looking for?
So you have your physical and your chemical exfoliators. So physical ones are like your little beads and things like that, or even some of those brushes. Those are great for like rough, thick skin. It's not a big deal. Chemical exfoliators are a little bit more gentle. You have your salicylic acids, you have your even retinoic acid to an extent. You have different acids that can exfoliate things out. Honestly, everybody should use it, but the question is how often do you use it, right? So if you have sensitive skin, I would maybe say once or twice a week just to cleanse, right? Just to kind of keep things taut and clean and proper. If you have oily skin, then 3 or 4 times a week. I also recommend exfoliating after every gym session. Even a quick little, like I have some salicylic acid in my gym bag whenever I go to the gym. So I go into the bathroom real quick, just wash my face, then I go back down. The gym's in my building, so it makes it easier, and I just go shower normally. But I do it almost immediately because you don't want that sweat piling up. But in general, like 3 to 5 times a week if you're acne prone, oily skin. If you have very sensitive skin, like I unfortunately do, maybe twice a week or so, or only after you work out when you actually have an active sweat in there. But it's good form. And again, the other cheat code that I like to kind of share sometimes is, let's say like, so the average skincare product, no matter how much you pay for it, only about 3 to 5% actually gets into your skin, like the active ingredients. So if you exfoliate before it, you got to be careful because if it's a strong product, you don't want too much of it. But if you exfoliate before doing it, you actually open up those pores a little bit more to absorb a lot of the active ingredients. So I do that a lot for like if you're doing like a good antioxidant or something like that, it's not a bad idea to exfoliate a little bit before, wait a little bit of time so that you don't have the pH issues, but you actually get a little better penetration. We actually do that a lot for like some of my hair patients. We actually put salicylic acid in their shampoos, and we actually get better penetration of like ketoconazole or even minoxidil.
Thank you. We're going to take one final question from the audience. Can chemical skin peeling clear your acne scars and dark spots?
So chemical peels. So yes and no. We do chemical peels here. So again, I have to always hedge my honest side. Like I don't know how to lie. So I think every one of my patients know. I say chemical peels are good, but there's a lot more other options we have. Like so, chemical peels were awesome in the 90s and parts of the 2000s and even early this last decade. But we evolved, right? So if it's dark spots, we have compounded medications we can do. We have lasers. We have different options we can provide for our patients. I think for acne, so the only real acne ones are salicylic acid cleanses, right? So I still, so my question becomes like, if you're doing a salicylic acid 30% peel, does it do a good job? Yes, but what's the long-term regimen? How is it going to be? How are you going to sustain it? How are you going to treat it long-term? So again, I still rather have a good medical plan in place because, I could take people's money forever and do chemical peels every month, but is that ethical? Like probably not, right? So my job is to kind of present options. And a lot of times we mix and match chemical peels into a regimen. So if I want to like really go for it, get a lot of peeling and get like, some clearance and then start a regimen, we do that. I think hybrid therapies are the answer almost always, and mixing and matching things. But just by itself, for me, I think it's very hard to recommend only chemical peels. It's just like I said, we have them, and I still don't recommend them first and foremost because I think it's part of a group of options, but not necessarily your primary option.
Thank you so much. You touched a little bit earlier at the beginning of this session about your work with what's going on right now with COVID-19. Can you just talk a little bit about that before we start closing out?
Sure. So, I'm a little crazy of a dermatologist, so I do a lot of tech stuff as well. So we're doing, we build a lot of technology for different things and telemedicine, EMRs, all these different things. So with COVID-19 right now, what we're doing is we're building out infrastructure. So actually my call this morning and yesterday was with the with the mayor of a city. We've talked with the governor's team, and what we're doing is we're building an infrastructure in place so people can get screened at mass volume, tested into the hundreds of thousands, care coordination remotely. So people, if they're positive with this virus, they don't have to come to the hospital. We can start treating them at home, and then funneling them to antibody testing as necessary, and then to even this coalescent plasma, which we take the antibodies from people who've developed them and help them for patients who are actively suffering. And we're working with, again, lawmakers, private insurance companies. I have 1,000+ doctors on my virtual network that are going to be helping with this project. Our job is to, we're doctors first, right? So I mentioned I'm going to be going to the hospital, I think at some point, at least I'm trying to. I've never tried so hard to volunteer in my life and not get called on, if you will. But it's interesting because we're doctors, right? I'm a doctor before a dermatologist always. And I told them very frankly, if I have to clean the floors and feed patients, whatever it is, I'm willing to do it to help my colleagues, my brothers and sisters who are out there. And so, I think I hopefully have a little extra, a little more use than that. But even on the skincare side of it, in the skin, there's different rash manifestations we're seeing. So, my job is to figure out what are we actually seeing, how are we seeing it, what does it mean, and so we're working with a few different agencies and different governor offices to try to develop this infrastructure in place. And the call last night was heartbreaking. It was with the head of something like 7,000 nursing homes, and they're trying to figure out how do we test our patients and our residents, and it's hard, right? Because how do you, like, this is a good time to reflect on the people who need it most and the care that we sometimes neglect and forget about. And for us, my job is to use technology and my medical background to help in any way we can. And so as the world kind of comes together, I think the medical world is also coming together. So it's not often I get on a call with a mayor, a hospital system, a insurance company. Lord knows I don't like getting on calls with them. And so, but all of us, we're working together, right? And so, our hope is that if we can leverage technology in our medical workforce, we can really start helping people at mass scale.
Thank you so much for all of this and for all that you're doing.
No, my absolute pleasure. I love the Hope fam, so I'm always appreciative to see you guys. And all I ask is you guys stay safe. Please take those warnings seriously. I'm a little worried about Florida because it's a little more lax down there, but this thing is for real. And in New York, unfortunately, we know a lot of people who've been sick. Some people didn't do well and didn't make it. I mean, it's one of those things where you have to, it's people like, oh, the numbers are down. It's not that big a deal. But honestly, it's because we're doing a great job of isolating everybody, right? So the counter to that is not isolating. I'm very, very scared of what happens if we remove too quick, too fast. So
There's a lot ahead for sure.
absolutely. I think I just saw Violet in there. So hi, Violet. Great to see all you guys there. And again, I send my love down to Florida. Hopefully when all this clears up, I'll come down and see you guys soon.
Thank you, Dr. Bhanusali.
All right.
One more thing for everyone that's tuned in, how can they locate you? How can they find you? You can read off your Instagram handle.
Oh, yeah. So my Instagram is at Dr. Bhanusali, so DrBhanusali. And then I'm here in New York, but also you can always send me a message if you need a good recommendation on dermatologists around. I mean, the derm world is very small. We're all family. So I have a ton of friends who I would send my own family members to all over the country. So just send me a note. I'm happy to help.
Thank you so much again for being here and for everything that you're doing. Dr. Bhanusali, we're so appreciative.
All right. I'll see you guys soon, okay? Take care.
See you soon. Stay healthy and safe. Thank you very much on behalf of Haute Living and the Haute Beauty Network. Coming up next at 2 p.m., we have Dr. Solomon here in Miami as well. Thank you.